Bismillahirrahmanirrahim. First of all, I'd like to thank the organizers, especially Dr. Malik and Dr. Wasi, for arranging this excellent stroke congress. And I have no financial disclosures related to this talk. So starting with, as Dr. Shirin did, most of the published work coming from AKU, most of the initial work, it was the same for the thrombolysis. The first paper that I found was by Dr. Wase and Dr. Aisha Kamal, and this was on the utilization and outcome of thrombolytic therapy for acute stroke in Pakistan. This is when they started doing using TPA at the 0.9 milligrams per kg dose. And then they analyzed this data from 2005 to 2007. So in this span of 3 years, 2 years, they had 18 patients. And around the same time, 2007, 3 patients from Liaquat National. And these were, you see Dr. Abdul Malik's name there. They were using the 0.9 dose, but they had problems there. So they had an increased frequency of fatal hemorrhages. And then they thought that, they analyzed that there was some protocol violations as well. So their conclusion was that the utilization of thrombolytic therapy is low and complication rate is high, and interventions for training of physicians are needed. So they followed this up with another study that was published in 2009, in which they had shifted in 2007 from the 0.9 milligrams dose to the 0.6 milligrams dose. And this was published in JPMA by Dr. Wase, in which they showed that using the low dose TPA for ischemic stroke was non-inferior to the standard dose in Karachi. At Shifa, we started using TPA from January 2015. And since then, we have been using the 0.9 mg per kg dose. So this is the poster presented by one of our residents, Dr. Falia, in the American Academy of Neurology, an analysis of 41 patients. And again, mean age was about 66 years, and 3.5% of the patients were eligible for and came in time for TPA. 3 patients had minor bleeds, and 2 patients had died, one due to a large stroke and other to aspiration pneumonia. Basically showing that the 0.9 milligrams dose that we were using was not causing any additional complications. A small analysis of the TPA that we used initially, we used to a third party to import it from. And there we used the 20 milligram vials as well as the 50 milligram vials. The cost was very high, over 200,000 rupees per patient, because we were using a third party. But later on, once we got the TPA through legal channels directly from BI, the cost was much less. The same thing you see here, the cost initially was high, but once we started getting the TPA directly from Boehringer at the special rate that we were given, the cost came down. But again, the cost, as you see, it has increased slowly over time. And the reason being our depreciating rupee. In 2016, April 2016, myself and Professor Mazhar Badshah from Pakistan Stroke Society, together we wrote to Boehringer, their head office in UAE, and we asked for availability of TPA in Pakistan. And we followed it up by a meeting with the Director General Health in Islamabad. And myself, Dr. Mazhar Badshah, and Professor Wasim Alamgir, We went to their office. We had a long discussion with the DG Health, and he agreed that TPA should be available in public sector hospitals as well. And they assured us of their support and facilitation. Soon after, in June 2016, Boehringer appointed Ali Gohar as their sole distributor. And this was quick, and we thought things were moving very fast at that time. And this was followed in November by Boehringer and Ali Gohar giving us, an undertaking that they will supply twin packs of 50 milligrams TPA at a reduced cost of $1,200 for the twin pack, that is $600 per vial, which was much cheaper than the rate we were getting at that time importing it from the third parties. In addition, they also gave us the undertaking that they would supply all the stroke centers in Pakistan designated by Pakistan Society of Neurology and Pakistan Stroke Society, and that none will be sold in the open market. Later on in 2018 and 19, things were moving very slowly on the registration part. Professor Athar Javed and Professor Qasim Bashir had personal meetings with the health authorities trying to push for an early availability of TPA. The Punjab Health Minister was also the chief guest at the National Stroke Conference in Lahore, and they agreed to facilitate TPA availability in public sector hospitals. This was a meeting held in Dubai by the Angels Initiative, which is a social group of Boehringer, and basically planning on how we are going to use the TPA once we get it, and what are the needs of individual centers, what are the needs in the big cities and the small cities. As you see that it was attended by most of the neurologists there. You see Professor Ashfaq Shoaib was there, and he was leading the group, and Wasi, myself, Hasnan, Ravi, and Qasim and Fawzan as well. And we did the basic planning initially. And the Angels Initiative, initially, they said that they are going to support us in training. It can be in terms of sending experts, including nursing experts, to our facilities, or sponsoring training abroad. The good news came in October 2020 when DRAP approved TPA, and they gave a maximum retail price of 96,000 rupees for a 50 milligrams vial. At that time, we thought, again, it's going to be available very soon. But that wasn't to be. And there were further delays. And so one of those delays was that once this was approved, just a month later, Boehringer applied for exemption from Urdu labeling. Now, DRAP has a condition that any drug that is made available has to have an Urdu labeling, as well as an Urdu translation of the packaging insert. So they applied for exemption from both. So initially, the translation of the insert was the easier part, but this, Urdu translation on the vial, this was the difficult part, and this took a long time and a lot of pushing as well. So some of the training sessions conducted by the Angels Initiative. One was this training done by the Czech Republic, and one simulation workshops. And this was again attended by, they asked us to nominate the centers that were already doing thrombolysis. And they wanted to see them make simulation videos, and so far to see how if it can be done in one center, can it be replicated in other centers also? So 4 centers from Pakistan were nominated by Dr. Anjum, including Arsalan, South City, uh, Hamid Latif, and Shifa. 2 centers from Pakistan completed their project and submitted recordings of running simulated case in the hospital to record the whole case pathways. Then there was another training session conducted on June 26, and then one on July 3 on thrombolysis, covering looking at the nursing aspects as well, which was attended by neurologists from all over Pakistan. So the current facilities, stroke care facilities in Pakistan, when I was preparing this, I came across this paper which had just recently been published by Dr. Anjum Farooq and Dr. Wase in on this very topic. So 10 stroke units have been established in different cities. Mechanical thrombectomy available at 4 hospitals in the country, with only 1 in the public sector hospital. Cost of care in the stroke unit is the single most important determinant of patients' ability to access stroke care at a private tertiary care hospital. It's very, very expensive. So we need stroke centers at the public sector level as well. And I was glad to hear the talk by Professor Omer today in the morning. Okay, now the centers that are available. I mean, this is the information I got from personally contacting most people. But AKU has in Karachi, it has a stroke unit. It's been there for a long, long time. They also have the mechanical thrombectomy option done by the interventional radiologist. South City Hospital, Ravi is there, and they have a stroke unit. Don't have thrombectomy as yet. In Ziauddin Hospital, they have stroke units in both their hospitals, both in the Nazmabad Hospital as well as in Clifton. And then Shifa International has a stroke unit from the start. And we also have mechanical thrombectomy option done by our interventional radiologists. Military Hospital Islamabad has all these facilities as well. And there the intervention is done by interventional neurologist, Dr. Jahanzeb. Hamid Latif Hospital in Lahore, Qasim Bashir is there, and they have all the facilities, and the intervention is being done by Dr. Qasim Bashir or interventional neurology. At Services Hospital, which is a government sector hospital where Dr. Qasim Bashir is there in the mornings now. They have recently started setting up their services. Interventional neurology is not available at present, but is going to be there in near future. And Fauji Foundation Hospital in Islamabad, as well as Services Hospital in Lahore, they have facilities for TPA. And Hashim has said that they have a stroke unit as well. Lahore General Hospital is also doing thrombectomy, as well as they have a stroke unit with Abu Bakr there, and interventional radiology doing the interventions. And the National Hospital in Lahore has facilities for TPA. So this is what is presently available. Now there are other centers who are going. They are interested in giving TPA once TPA is a registered drug in Pakistan. And these are the Liaquat National Hospital, which initially in 2007 did some TPA, but then stopped doing it. So they just a couple of weeks back, they organized a workshop as well, a hybrid workshop, in which they said that they have done the mock runs and they are ready to proceed with the TPAs in a few weeks' time. So they've asked for, this is their requirements over the next 1 year. Liaquat National Hospital wants about 48 vials for the next 1 year. South City 24, about 2 per month. Arsalan University around 30. Mimon Medical Center has asked for 15. Ziauddin Hospital similarly. The National Medical Center in Karachi, Bojo there. Liaquat University of Medical Sciences, Bolan Medical Complex, as well as Darul Sehat Hospital. Dr. Abdul Malik is there. They would also like to go ahead and thrombolyze once it's available. So Dr. Fozan is listed at Rahman Medical, but I just called him a few days back and found out that he'd moved to Swat, so correction there. Then Mazhar Hamdani is in Muzaffarabad, and he's also interested because he doesn't have enough time to send patients to the larger city, to Islamabad. So he wants to start there as well. And then the other centers, as listed, they've given their yearly demand. So, the question again comes, when will TPA be available in Pakistan? I spoke to the Aligarh rep a week back, and I was thinking that probably our first shipment would be here before I give this talk. But he's told me that the first shipment of TPA is expected in the first week of November. And there is another catch here. The catch is that they require another draft clearance. And when I asked them why do they require it again, so I was told that for every biological drug, they need another approval. And they estimate that 30 days will be required here. So as you're looking at it, that 25 years ago, TPA was approved by FDA. And we thought that it will just take us a year or so to make it available in Pakistan. But it's taken us more than 5 years with a lot of pushing from our side. And the delays have been at different ends. And it's very difficult to discuss the reasons for delays here, but it has been delayed. And we don't even know how much more delay. This is what they're telling us, but we do expect more delays. One of the reasons being that our rupee has depreciated, and the price given by DRAP was at the previous rate. So I am foreseeing that there will be some more delays here. So PSS has to take the lead. As most speakers have said, in today's talks, Dr. Malik's talk, and then Dr. Ismail Khatri as well, that the neurologists and the Pakistan Stroke Society has to take a lead. They have to set their minimum standards. We have to educate the neurologists. We have to increase stroke fellowships. We have to train the nursing staff, train the ER staff as well, train the ambulance service staff. So the ambulance service staff knows that when they are transporting a stroke patient, where do they have to take the patient? They have to take the patient to the closest stroke center. And, not the least, we have to increase awareness in the general public. So with that, I end this talk. Thank you.